All right, well, it looks like our session is starting here. I want to welcome everyone to this session and thank you for coming. This is the Poverty Action Center, which is part of the Regional Economic Development Institute at Colorado State. We're a group that is involved in several projects that relate to international development, and we wanted to share some of that work with you as part of this session. Just before we get started, I want to mention that we're thinking that this is the Poverty Action Center. Our goal is to use interdisciplinary mixed method approaches to help guide poverty action locally and globally. And we have a number of researchers who have joined us today that are going to show you some applications of survey design, econometric data analysis to answer questions that are here at the intersections surrounding poverty, inequality, education, gender, microfinance, among other topics that we are interested in as well. Our vision really surrounds using both academic research, linking that with economic policy analysis, and then bridging into outreach and engagement. And we're interested in working both locally and globally. Being the International Symposium, we're going to focus in on the global aspects today, but we're also involved in some work that we're doing locally within Fort Collins as well. We're very interested in growing our network, both within and beyond Colorado. We're interested in continuing original, interesting data collections. And we're definitely interested in meeting all of you and working on some of these designs to answer questions that are linked to our goals here. Just to get started here, I will put our web address up on the screen. We hope that you will check us out. My name is Dr. Anita Alves Pina. My contact information is here on the slide. I'm one of 4 faculty members who are involved with the leadership of this particular center, along with Alex Bernasek, Miros Bataray, and Ray Miller, who are all in attendance as well. And we have a number of graduate students who are actually going to present some of our research in progress today. So I will let them introduce themselves and also indicate who's involved with these individual projects as we go through. So I'm going to turn the floor over to Brendan first, who is going to go through a project that we're working on that surrounds Haiti as a starting point.
Hello, everybody. Today, our group will be presenting the relationship between WASH, water, sanitation, and hygiene, and women's empowerment in Haiti. The participants are Brendan, Wisnu, Dr. Bernasek, and me, Arisa. And thanks to Sid for earlier work on this project. The UN established 17 Sustainable Development Goals to be achieved by 2030. Regarding WASH, the 6th goal aims to ensure availability and sustainable management of water and sanitation for all. These are some examples of global WASH issues as of 2020. 26% of people around the world do not have access to safely managed drinking water. 46% do not have access to safely managed sanitation, and 29% do not have basic hygiene. For women empowerment, the 5th goal aims to achieve gender equality and empower all women and girls. Women's empowerment is a huge global problem since 1/3 of women around the world said that they have experienced physical or sexual violence, and women spend 2.5 times as many hours as men on doing unpaid domestic and care work. Haiti is one of the poorest countries in the world, and it has a very poor WASH, such that more than half of the Haitian population lacks access to drinkable water, and more than 66% do not have access to basic sanitation. There are also issues regarding women's empowerment. 26% of Haitian women experience physical or sexual violence in their lifetime. The UN's established Gender Inequality Index that measures gender inequality. The higher indexed value and ranks, the more disparities between females and males and the more loss to human development. And Haiti ranks in 142nd place, which indicates that the gender inequality is very high. So why does this matter? Poor access to wash could lead to disease and an increase in mortality rate, but this is totally preventable. The UN Sustainable Development Goals for WASH and women's empowerment are divided into two different goals, but they are intertwined. As we can see from this example of how poor WASH could negatively affect women empowerment. Women and girls suffer from poor WASH since safe WASH is essential for menstrual, sexual, and reproductive health of women. Lack of safe WASH could lead to a decrease in school attendance for girls in puberty. Violence against women and girls is associated with traveling long distances to collect water or use toilet facility, and women and girls provide most of the unpaid work with WASH, such as doing laundry, cleaning, childcare, and cooking. In this research, we used data from the Demographic and Health Survey for Haiti. We have 3 years of data, which are 2005, 2012, and 2016. We have 1 year before the earthquake and 2 years after the earthquake. We then created 3 measures of women's empowerment related to decision-making, independence, and violence. We also created 3 WASH measures, which are access to improved water, access to improved sanitation, and time to collect water. And we want to find the relationship between the empowerment measures and WASH measures.
All right, hi, I'm Brendan. I'm going to talk about the data a little bit. So we create 3 measures of WASH that become our main independent variables. And we estimate these effects separately on women empowerment. So our 3 measures are improved water or improved drinking source, improved sanitation, and time to collect water. We classify improved and unimproved using the DHS classifications, which is common in the literature. So these classifications are the different sources that appear under our WASH variables. So for improved water, piped water, public tap water, and so on are considered improved, and all other sources are considered unimproved. And it's the same thing for improved sanitation. These are underneath here, we have our improved sources, and all other facilities are considered unimproved. For time to collect water, we look at the effects of less than and more than 20 minutes. This is also common in the literature to use this 20-minute marking. And so what we do is we code all of these variables as being 0 and 1. For improved water and improved sanitation, 0 corresponds to not good WASH and 1 good WASH or improved WASH. And for time to collect water, 0 corresponds to less than 20 minutes, which we say is good, and more than 20 minutes, which is not good. So now we'll talk about our dependent variables, which is the women empowerment indexes. So we create 3 indexes for women empowerment using principal component analysis. And this is rather interesting because it allows us to take a group of variables and combine it into just one variable. And we do this for each one of our indexes. So for example, our first index is our decision-making index. So we take variables such as who decides own healthcare, who decides large household purchases, who decides visits to family, and who spends their own earnings. And we put this in the PCA, it combines it, and we have a decision-making index. We do the same thing for violence. The violence questions are basically questions asking when it's justified for a husband to beat their wife. So it's really attitudes towards violence. And then we also do the same thing for independence, different independence questions, right? We also have control variables, which are also common in the literature. And these are different demographic characteristics number of household members, sex of household head, total number of children, religion, if they're currently working or not. We have year, which we have 1 year before the earthquake in 2005, and 2 years after the 2010 earthquake in 2012 and 2016. And we also have married. This variable is starred here because it's only estimated on one of the women empowerment indexes, which is violence. This is because decision-making and independence are only asked to married women. So we don't include this control in those regressions. So here we have our summary statistics. The highlighted portions are our interest. The top portion is our women empowerment indexes. So we have decision, violence, and independence. You can see that the observations are different between the three. Decision-making is only asked towards married women who get paid in cash. Violence is asked to both men and women, and independence is asked to just married women. We standardize these PCAs and then form them into quantiles. For decision, we have quantiles running 1 through 6, violence 1 through 2, and independence 1 through 7, where 1 is corresponding to not good empowerment, and the higher the numbers is good empowerment. Right? Then we have our WASH variables. They're all coded 0 and 1, 0 or 1, where we have 67% of our population having improved water, about half having improved sanitation, and about a third taking more than 20 minutes to get to their water source.
Brendan, 2-minute warning.
Gotcha, okay. And then, so right here is kind of our estimation strategy where we estimate women empowerment. We estimate the effect of women empowerment from WASH, so Y is women empowerment, and Z is our WASH variables. And we use our control variables, and also we control for regional fixed effects. So we'll get into the results here. So here's our results. WASH variables significantly impact all of our women empowerment indexes. So each one of our WASH variables has a significant impact on decision, violence, and independence. And they all move in the direction we suspect, like improved drinking and sanitation increase women empowerment, and more time to get water decrease women empowerment. And that's why the time one is negative here, right? So what we're saying is that better WASH means better empowerment. Our last bit of results here is showing our average effects from different levels of WASH. We control our control variables at their means, and we look at what a person's ranking would be if they had no good WASH, if they had just 1 good WASH, if they had 2 good WASH, or if they had all 3 good WASH. And what we found is that decision-making increases by 10%, going from no good WASH to all good WASH. Attitudes towards violence increase by 7%, and independence increases by 39%. Right.
So from doing this research, we found that WASH and women's empowerment in Haiti are significantly correlated as we expected. Improved WASH and less time to collect water are positively correlated with our 3 measures of women empowerment. We found that the 2010 earthquake did not affect the relationship between WASH and women's empowerment, even though WASH quality was negatively impacted by the earthquake. And from a policy perspective, our results suggest that the 2 UN Sustainable Development Goals, which are the 5th and the 6th goals, are connected, and the efforts to improve WASH will also improve the well-being of women and girls. In the future, we'd like to extend our analysis to go further in establishing a causal relationship between WASH and women's empowerment. And however, there are some limitations to our data, in which the smallest unit of analysis available in the Haiti data is only 10 departments or region, which limits the use we can make of regional variation in effects of the earthquake. Another limitation is that not everyone was asked all the questions that we use in the principal component analysis. So we had to focus on married couples and had to exclude information on single households in the decision and the independence PCAs. This is the end of our presentation. Thank you.
Thank you, Risa and Brennan. So I would like to mention that we are interested as a group in poverty and inequality broadly, but one of the focus areas in some of this secondary data analysis that we've been working on recently has been in water sanitation and hygiene space. And so we're actually going to move to an application for the case of India, which is also interrelated to what we were doing here with Haiti. So I'm going to turn the floor over to Ashish.
I cannot start screen share while the, okay, now I should be able to do that. Okay. I hope that you're able to see my screen now. Okay. So the topic that I'm going to discuss is who benefits from piped water, evidence from a gendered analysis in India. This is still a working paper, so I would love to have your comments and thoughts on this. So moving forward directly, I would like to first go into this quotation by in New York Times in 2021. It says that a woman in the state of Madhya Pradesh is a mother of 3 living in the central Indian state of Madhya Pradesh. She says that I go out and put jerry cans and queue in the morning at 5 a.m. and wait there with the children. Sometimes it could take 5 or 6 hours to fill water. If I have to stay there because if I leave, someone else moves ahead. With regards to the problem of supply of water, Jyoti Abadia, who is a council member from the supply side, administrative side of supplying water to households in India, says that people believe that if ration is free, meaning with food is free, house is free, child delivery is free, wedding is free, then water should also be free. So these two statements kind of highlight the problem of demand and supply of water. In the sense, on one hand, people are desperately trying hard to get water, access to water, and spending a lot of time to get water, while on the other hand, people are also believing that water should be available for free. Now that brings us to this idea that safe tap water remains like a privilege in India, a dream that has been unfulfilled for a long, long time now. Only less than 35% of households in India have access to piped water. In rural areas, it's much lower than in urban areas, access to piped water. And as you can see here in this figure, you can see that in India, these darker regions represent more access to water, whereas the lighter regions represent lesser access to water. This data is classified at the district level. And you can see that between 2005 and 2012, there has been some significant improvement in access to water, and that is the policy that we are using for our empirical exercise in this paper. We see that in rural areas, the sources of water are mostly tube wells and boreholes, while in urban areas, the sources of water are mostly piped water in the dwelling yard or the plot. And even the quality of water supply, in the sense of how many hours water is available in the household on a daily basis, is very poor in India. As you can see here, households kind of receive hours of water on average only around 3 to 4 hours a day. These darker colored areas represent more number of hours of piped water in a day, and lighter color represent lesser number of hours of piped water in a day. And except for a few cities, the access to water is very low in terms of number of hours it is available to households. Why is this important from a gendered perspective or a developmental perspective is because this daily water needs of the households requires water collection, storage, maintenance. These responsibilities primarily borne by women, and adult women in India kind of spend around 1 to 2 hours every day collecting water. For those who are collecting water, they spend around 1 to 2 hours every day in collecting water in rural areas. So given this disproportionate burden of water collection on women, I argue that the intra-household labor and health inequality could be larger in the absence of piped water for households. And this problem is important because in India, over the past 2 decades, there has been a spectacular decline in labor force participation for women. So in that regards, having access to indoor pipe drinking water could be a game changer in terms of allowing women to reallocate their time from water collection activity to labor market activity. And the other thing to understand about pipe water is that the problem of pipe water is not only an economic problem or a logistical problem, it is also a social problem in India, in the sense that the caste marginalizations in India based on water has been there historically and it's still persistent. People from non-marginalized caste tend to gain more access to water as compared to marginalized people. So far, there have been studies that have looked at pipe water, child health, pipe water education, pipe water, child schooling, pipe water, child illnesses. But most of those studies have been cross-sectional in nature. So in terms of the data contribution, what we are contributing here is using a longitudinal study to see the effect of access to pipe water on not only a few variables of health and education for children, but a holistic number of variables, a wide-ranging number of variables that look at not only employment outcomes, but also labor force participation, employment inequality, health and child schooling from the perspective of India. So these are the questions that we are trying to address. This is the hypothesis that we pose forward. With regards to employment, we argue that access to piped drinking water would increase the likelihood of employment. It would increase more for women than men. Earnings would also increase more for women than men, and differences in labor force participation between men and women would reduce with access to piped water. We also argue that access to piped water reduces health problems for women. It also reduces short-term morbidities, and it also leads to lesser illnesses and higher school participation for children, more for girls than boys. So some of the results that we have derived from this study are, first of all, access to indoor pipe drinking water kind of reduces the likelihood of farm work and increases the likelihood of wage salary work. Now, how that works is that once we see an increase in access to pipe water at the household level, one can easily anticipate that it also means higher access to pipe water at the village level, which means in fields also they would have, in agricultural fields, there is more access to water. And more access to water in the fields means more easier plantation of crops. The plantation of crops is something that women primarily do in developing economies, including India. And so the activity of planting crops in the field becomes easy once there is an access to water in the fields. So that time is saved from that agricultural activity. And so you move towards the more likelihood of having a wage salary kind of employment for women with access to indoor pipe drinking water. Annual work days increases by 8.3 days for women with access to pipe water and 4.7 days for men in rural areas with access to piped water. Indoor pipe drinking water also increases the annual earnings for women. Annual earnings increases by 14% in rural areas and by 4% for men. So comparatively, women earn more than men starting from the benchmark level. And the increase in the earnings is higher for women as compared to men. And also the increase in the work days annually is higher for women than men in rural areas. But the effect of indoor pipe drinking water on labor force participation is only a rural story. And in fact, in urban areas, the effect of indoor pipe drinking water on women's employment is not there as per the results that we have derived.
You have a 2-minute warning.
Thank you. So the mechanism of effect in rural areas is through time allocation efficiency. In the sense, if you do not have to collect water or if it is readily available, you have more time to join meaningful paid employment. But in urban areas, the effect is on health. So indoor pipe drinking water improves health outcomes in urban areas. Now, this is because in urban areas, the surface level contamination of water, which is not piped, is higher. So we expect that the health benefits of having water would be more in urban areas as compared to rural areas, and more for women, especially because they are the ones who get in touch with the source of water, and so expect more contamination to them, and so their health would deteriorate faster than the others in the family. So we find that with indoor pipe drinking water, self-rated health of women improved significantly, and more for women from poor households. This is because they would be more inclined to have a contaminated source of water. The likelihood of diarrhea, which is a major illness in India, one that takes a lot of lives, also reduces by 2.2 percentage points in urban areas and 1.2 percentage points in rural areas, kind of showing that water is essential in maintaining child health. There are lesser number of ill days in urban areas. Household members get ill for lesser number of days with access to pipe water. And the reductions in illnesses are higher for women from poorer households. So again, poorer households tend to benefit more, especially women from poorer households tend to benefit more with access to pipe water in terms of being ill for lesser number of days in a particular month. School absence reduces by 2.4 days a month for girls, more than boys and more in rural areas. And 2.4 days a month could imply linearly, if we take this estimate linearly, in a year, it could imply somewhere around 25 to 30 days of lesser schooling with absence of piped water. And this could be critical informative years in terms of creating human capital, and could be one of the reasons why in later years there is a lesser demand for women in the labor market because of unemployability or lack of skill. This schooling is critical in that regard. So pipe water then becomes a critical element in understanding how the differences between girls and boys' educational outcomes take shape in the absence of infrastructures. So these are some of the results that we have. I would be very happy to answer any comments or questions you might have. Thank you.
Thank you, Ashish. So we wanted to give you some examples of our work today, both in terms of projects that are well underway and well developed, and also some that are newer projects for us. And so we're going to move into one of those newer projects next. We have an application from the context of Nepal, and I believe Sid and Wisnu are going to present.
So hi everyone, can everybody see my slides? Yeah, right, okay. So I'm Sid. So one of the projects we are currently interested in is understanding whether migration can help reduce discrimination between different social groups, especially in countries like Nepal. Now, before I go any further, I just want to briefly talk about Nepal. So Nepal is a country in South Asia sandwiched between India and China. It became a democracy in 2007 after a decade-long civil war, and being a very young democracy is still politically unstable. Now, although Nepal is a religiously tolerant country, it has always been a Hindu majority country and hence shares many cultural traits similar to India. South Asian societies have historically been divided into groups through a caste system, the basic idea being that the caste you are born into determines the occupation and social ranking of the individual. The gist of the system is that roles such as educators, priests, etc. are reserved for higher castes, whereas people from the so-called lower castes are relegated to low-skilled occupations. Although gender and caste discrimination is constitutionally illegal, cases of discrimination is still common. Now, if one has ever visited Nepal, or India for that matter, it is fairly easy to notice how deep-rooted the caste system is. These here are just a few papers that showcase the societal divide in Nepal. Here I want to put some focus on the second bullet point, where Bohra and Karki find that the economic gaps between Dalits, who are the historically marginalized groups, and non-Dalits can largely be attributed to endowment effects. This more or less is similar to the racial wealth gap one can find here in the United States. So not only this, one's caste also determines how successful one's entrepreneurial activity can be. So given the situation, the natural question that follows is how can an individual overcome these forms of discrimination? Now, one way for marginalized groups to escape the labor market discrimination is to migrate to a different labor market, free of such cultural constraints. So this migration could be to city areas internally or abroad. So like those from the non-marginalized groups, many individuals from marginalized groups in Nepal have started migrating for work over the last few decades. One thing I would like to point out is that migration in itself is self-selective, meaning that individuals from marginalized communities are likely to migrate to India or internally since they lack more sufficient funds to travel west. Now, our research aims to understand whether international migration allows these groups to bypass the labor market discrimination back home and help the households advance economically. The intuition is that once a migrant is out of sight, caste-based occupational rigidities also gets out of mind. So just briefly, I want to talk about the migration patterns in Nepal. Almost 90% of the Nepali workers that migrate for work go to Malaysia and Gulf countries. However, unlike migrants to Western destinations, most migrants in Gulf countries and Malaysia return home after working. So the basic premise is whether the fact that they or somebody that they know from their households returned from working abroad significantly changes the labor market opportunities they have back home. Migration to India is unique in that Nepali citizens can freely live and work in India without the need of extra documents, and hence migration to India for work is officially not recorded. So our plan is to, by dividing migration into 3 groups, that is internal migration, migration to India, and migration abroad. The aim is to study whether migration patterns reduce the socioeconomic gap between the privileged groups and the marginalized groups. For this, we are using a 3-year household survey provided by the World Bank. These 2 last.
Sid, you have 1 minute, okay?
Okay, cool. So the last 2 slides are basically some summaries from the data. The survey has roughly about 30,000 observations, and as we can see, majority of migration abroad is centered around India, Malaysia, and the Gulf countries. Just recalling back to the earlier slides, households in the mountain region. So this is the mountain, and this is where Nepal borders India. So people in households in the mountain region are on average poorer than those in the southern regions. And as we can see, the money sent by workers varies based on where they come from. So what we are basically planning to do is divide the data and see patterns of works from non-deprived and deprived communities. As we can see, Malaysia and Gulf countries have a majority of workers coming from non-privileged households. So what we are currently analyzing is whether workers in these regions are, firstly, sending more money compared to non-privileged groups, which in turn is being used to improve the socioeconomic gap of their family back home. Or second, we're trying to find out if having returned home, these people from marginal groups are now engaging in a higher level of occupation, which includes entrepreneurial activity. So like Anita said, it's still under work, so any comments and suggestions would be greatly appreciated. Thank you.
Thank you for the presentation. So we started today in Haiti. We took you to India and Nepal. And then last but not least, we're going to take you to Ethiopia for another project that is also a work in progress. And then we're going to open the floor to questions about any of these projects. I'm going to turn the floor over to Laxman.
Hello, my name is Laxon Modenda, and I'm an econ PhD student. I'm also part of PAC REDI. Professor Pena and I are trying to understand cooking fuels, drinking water, and time use in rural Ethiopia. Oops, slides are moving. I'm sorry, my slides are not, okay. Drinking water was declared a human right by the United Nations General Assembly in July of 2010. And of course, there have been a lot of efforts to sort of improve access to safe drinking water. For example, the United Nations Millennium Development Goal, Target 7C, indicates that by 2015, the target should be to reduce the number of people without access to safe drinking water by about half. And if you look at 1990 as a baseline, you can see that 76% of households around the world had access to safe drinking water. And by 2015, this had improved to about 91%. This is a lot of progress. And as Everard has put it in 2019, this is the first international drinking water target to ever be met in the world. Regardless of this progress that has been made, large numbers of people still remain without access to basic levels of drinking water, as we saw in the presentation by Arisa and Brandon. With regards to cooking fuels, more than 2.6 billion people worldwide still do not have access to clean cooking fuels. And when it comes to sub-Saharan Africa, to be specific, about 68% of the population still relies on unclean sources of cooking fuel, according to the International Energy Agency. And because of deforestation and poor road networks, we see that household members travel long distances to just collect firewood and water. And this brings in a concept of time poverty, where household members, especially household heads and parents, do not have enough time to devote to taking care of their children, or even devoting some of their time to providing in the labor market. Just a brief overview of Ethiopia. Ethiopia is in the eastern part of Africa, and as of 2020, the World Bank estimated the population to be about 115 million people. You can see that the GDP per capita is less than $1,000. Only about 19% of the population has access to the internet. 80% of the population of Ethiopia lives in rural areas, while only 20% lives in urban areas. So the research question that we're trying to answer to address in this research, to try to understand the impact of access to improved cooking fuels and clean drinking water on time use for labor activities, and also try to understand that on child health outcomes. In addition to that, we would like to also study the gender differences in the collection of firewood and how that affects time use in unpaid work. The data that we're relying on comes from the Living Standard Measurement Survey that is done by the World Bank, and we're relying on 3 waves of those surveys, the 2012, 2014, and 2016 waves. And from these 3 waves, we've been able to follow 3,613 households in rural and small towns of Ethiopia. And of course, the baseline number of individuals is about 18,864, but this number varies due to death and of course, births. So just as a summary, in terms of cooking fuel, we can see that almost 90% of the households rely on collected or purchased fuel, and those are highlighted in blue. And observing the same households over time indicates that about 78% of them collect firewood for cooking fuel. Cooking fuel such as electricity, clean fuels such as electricity or gas or even solar energy account for a really small percentage of these sources of cooking fuel for households in Ethiopia.
Laxon, you have your 1-minute warning now too.
Sure. All right, thank you. With regards to sources of access to clean water, we see that majority of the households rely on wells, springs, and rivers for their water, while a small proportion relies on piped water or water that is accessed from retailers. But we see some variation between 2012 and 2016, where piped water has sort of improved, and we're trying to see if we're able to exploit this variation in this study. With regards to collection of time devoted to some of these activities, we notice that men spend less time on collection of water and firewood, and the total time spent on both activities is roughly around an hour on a daily basis. So the modeling approach, as Anita said, this is really tentative. So the modeling approaches that we're trying to apply in this paper, one is coming from Rahut in the 2020 paper, where they study Pakistan. And we're trying to employ the Probit model based on this paper. We also will use instrumental variable approach to understanding the free collection of drinking water based on Kodri and Desai's 2021 paper. With the understanding of the free collection of firewood, that is not yet decided, but indications show that we might use the bivariate model that was used by MOSA. Basically, that's the brief introduction to this. Thank you.
Thank you, Laxon. So as I mentioned, we're definitely a group that involves faculty and then also graduate students and undergraduate students. If I'm sharing properly, I have our slide with our contact information back up, and including our website for your reference. And I just want to mention that we're very proud of all the presenters who are all students that are part of our group today. And so we are ready to take any questions that the audience may have. And I'm going to say that while I'm sharing here, I'm not sure I can see anything that might be popping up. So
If people want to just type into the Q&A,
mm-hmm.
then we should be able to see questions that come up in the Q&A box.
So one question that came up was, where can I learn more? And so our website is definitely up here. It is also a work in progress, but the larger REDI website has a lot of information about our umbrella group, the Regional Economic Development Institute, and then the Poverty Action Center is a subgroup of that. So more information definitely on our website or via email to any of the faculty members who are involved. We can definitely get you in touch. I believe, yeah, it would have to go through the question and answer for us to see any other questions that might be there for the audience. All right, well, since I'm not seeing any questions pop up yet, at least in my view, and I'm hopefully not missing anything, but I will maybe pose a question to our students in terms of how their work with PAC REDI may be related to things that they're interested in terms of their own dissertation research, if they're a graduate student, or their research as an undergraduate student. And so I'm hoping some of you would be willing to share your experience working with this group and also how this relates to your own research. And I'll call on Brendan.
I was about to start
Okay.
anyway, but yeah, so mainly in terms of my research, I'm now interested in international economics. And so I feel like doing the project on Haiti, getting used to survey data, working with different types of databases is definitely going to play a role in helping me do my thesis research or whatever I decide to do. And also just the intersection between international economics and development economics that we did with the Haiti project will definitely help me as well.
Thank you, Brendan. I'll turn to Sid, who's also in your same cohort in our graduate program.
Yes. So coming from Nepal, Nepal has been dear to my heart and all the research surrounding it. And it was a great opportunity to work in Nepal. But the thing about this is it's made me more aware of the kind of stuff I want to do. And I've realized that I really want to work in development economics. Not saying there's not other projects that are in mind, but this has just so working for PAC REDI has just helped me understand, oh, I really want to do this stuff. So it's more like a certainty now. So hopefully I'll do something around this for my dissertation as well.
Excellent.
And that's it.
We're happy to have you. So we have an undergraduate student who presented as well, Arissa. Maybe you can tell us a little bit about your plans following graduation that's upcoming.
I'm mainly like interested in working with data, and also PAC REDI allowed me to explore more field of economics that I've never like taken the class on before, and it is really related, and the problem is like really relatable, and we can see it as like a global problem. And also not only the data like skills that I think I've gained, but the communication skills and like the presenting skills too.
Yes, we love that you jumped into the presentations today as well. So we do have a question in the chat that I believe Brendan is writing an answer to, but I'm going to say it out loud as well. So the question was, for the Haiti case, is there any difference found between roles of adult women and young girls? Education opportunity could play a larger developmental role for younger girls. And then the extended question is that this may actually apply to some of the other projects as well. But let's address it first in the case for Haiti.
Yeah, I can just say it out loud. What we found is we didn't necessarily look at the education opportunity with age, but in regards to age, we found that the older the woman is, the better women empowerment is. So there's a really, really strong correlation between age and women empowerment, and it's positively correlated.
Does anyone have any comments for any of the other countries that could add to this? Younger girls versus women.
Well, I can point out for Nepal, and it's from my own understanding. So I don't have a specific data, but one could say after the 1990 cohort, let's say women born after 1990, especially if you're living in the city area, there has been a drastic change, and then there's more women going to finishing high school and then going to undergrad education and all that stuff. And in the city areas, you're also finding a lot of young women in trying to make it into music and other industries, which were historically not like industries women were supposed to go to. So that's a positive change, I could say.
I might just jump in too, because in the Haiti situation, one of the things that was a little bit, not as optimistic was that when you looked at who were the main people who collected the water, it was overwhelmingly women and girls. And so even, the adult women were the main collectors of water. The next group, the next most important group were young girls. And then men and boys come in, pretty significantly behind. So in terms of this wash issue, it does seem to still, have a significant spillover effect by gender, and girls are having much higher expectations of having to do that kind of thing than men or boys.
All right, I would like to jump in here and just say a huge thank you to all of our presenters and panelists for this wonderful session. For everyone that joined us today, thank you so much for being here. For everyone out there in the audience, we do hope that you will join us for the rest of the afternoon. We have a full day of sessions today, as well as tomorrow and on Thursday. Once you exit out of this Zoom room, there will be a short survey. So we do hope that you will take the time to complete that. Again, thank you so much for attending from the Office of International Programs. Have a wonderful day.
And thank you to the Office of International Programs for having us as well.